Opioid-induced constipation, or OIC, is one of the most common and distressing side effects experienced by patients on long-term opioid therapy. Despite its high prevalence, affecting up to 80% of chronic opioid users, OIC is often underdiagnosed and poorly managed. This can significantly impact a patient's quality of life, sometimes even more than the pain for which opioids were prescribed. Underlying cause of OIC is the action of opioids on specific receptors in the gut, which slows down gastrointestinal motility and increases fluid absorption, leading to harder stools and more difficult bowel movements. Unlike other opioid side effects, constipation rarely resolves with continued use, making proactive management essential. Raising awareness among both patients and healthcare providers is the first step toward better outcome. Effective management of OIC begins at the very start of opioid therapy. Patients should be informed that constipation is a nearly universal side effect, not just a minor inconvenience. Preventive measures such as prescribing suitable laxatives, preferably osmotic agents like macrogol, should be considered alongside opioids, especially for elderly or cancer patients. Early assessment is crucial. Within 2 weeks of starting opioids, clinicians should evaluate bowel function using tools like the Bristol Stool Form Scale and the Rome IV criteria. Regular monitoring helps identify OIC early and allows for prompt intervention. Nurses play a vital role in patient education, ensuring that patients understand what symptoms to watch for and when to seek help. This proactive approach can prevent unnecessary discontinuation of opioid therapy and maintain effective pain control. When constipation persists despite appropriate use of first-line laxatives, it's time to consider peripherally acting microopioid receptor antagonists, or PAMORAs. These medications, such as methyl naltrexone, naloxegol, and naldomiting, specifically target opioid receptors in the gut, restoring bowel function without affecting pain relief. For prescribing PAMORAs, clinicians must review potential drug interactions and educate patients on proper use, emphasizing that these drugs should be taken regularly and not discontinued without medical advice. Monitoring treatment effectiveness is essential, using tools like the Bowel Function Index. If there's no meaningful improvement after 4 weeks, options include adjusting therapy, combining treatments, or referring the patient to a specialist. This structured, stepwise approach ensures that OIC is managed effectively, improving patient comfort and quality of life. Streamline OIC management. Experts recommend a 7-step clinical pathway. First, inform every patient starting long-term opioids about the high risk of constipation. Second, co-prescribe preventive laxatives. Third, assess bowel function within 2 weeks using validated criteria. Fourth, if constipation persists, consider PAMORAs. Fifth, review drug labels and educate patients on proper use. Sixth, monitor efficacy with the Bowel Function Index. Finally, reassess after 4 weeks of PAMORA therapy and adjust the plan as needed. This structured approach, endorsed by European and Italian experts, emphasizes early intervention, regular monitoring, and individualized care. By following these steps, clinicians can improve outcomes for patients, reduce unnecessary suffering, and ensure that pain management does not come at the cost of quality of life.